So what do you think? Let's grab drinks after this.
Sounds good.
Funding wallets on TapTapSend. Step 1. Click on Create Ghana Cedi Wallet below when you open the app. Step 2. Enter amount of your choice in Ghana Cedis. Step 3. Click on the Confirm and Fund wallet below to confirm. Step 4. Your wallet has been successfully funded. Step 5. Enter amount of your choice in Ghana Cedis. Step 6. Select or add new recipient. Step 7. Choose wallet as payment method. Step 8. Click on the Pay with Wallet below to confirm. Step 9. Your transaction is successful.
A very good evening. And I know Dr. Akosua Ofosua say you are on mute. I know, I'm on mute. Very good evening and welcome to your Wednesday evening health talk show with your servant, Dr. Akosua, Dr. Kwadwo, and Miss Abena. And Dr. Akosua Ewaha, Miss Abena Iniha, and Dr. Kwadwo. Please don't ask me any medical question. Since me no mean to me, Dr. Akosua will answer all the medical questions or at the Emanum. Anyway, we are talking about something very special, very unique. Ama me no me nyina enti me se wa bomodin afre onua bi anadamfo bi na ka chen se ono nso joining ewo OT health talk no so ene doctor ewo hanom se obeboa na wama enchechiremu all the questions that we've got, especially when it comes to any health related issue be Dr. Akosua ebe answer ede amain. And in tene yen che ho kra yebeko na yene Dr. Drink komoni ahwe ene ide ye kan wasem na I take you over to talk to us. Doc, a very good evening and welcome to the show.
Good evening, and I'm here to say.
Yamina dom ho ye pa na so e.
Oh, nyame adom wi aboko.
Doc, Mbacho, wait there, just a reminder. Are we going to have whiteboard today?
Baby, and then the can of whiteboard who here, but say yes, I am back out when the last week I can end the whiteboard, ever.
Okay, yo, but that's it. And your dog, take over. Yeah, too.
First, once again, thank you very much for obviously hosting the show. Thank you to TapTapSend T-shirts now, Shana Karibia, TapTapSend for being part of the show, helping promote this program and OT Health Talk as well. We really appreciate you. Without you, the knowledge that we are spreading could not have been spread. So we really appreciate it. And welcome to everybody who's always here every week. I'll delve into it because and there's any I'm coming. My usual co-host, Dr. Kojone, Miss Abena, almost say well, ying and I you took one actually. You took one, but almost say because my work does not allow me to have so much time off into next week and the following week I'll be joining them into next 2 weeks. We will not be here, but Nana Kwame will stand in for us, and we also have our favorite Dr. Mustafa coming to give us some knowledge next week. So I just wanted to send a message from them saying, so almost say, because I'm more chilly, but I'm and so yeah, so get straight into it. So today I'm talking about sepsis, and a lot of people, I guess you would have heard about sepsis, especially there's been a lot of promotion from the NHS trying to drive knowledge about sepsis. And I think it's important for the African community and the Black community to also know about it, because we hear the word being thrown around, but do we actually know what it means and what it means for us? Anybody can get sepsis. It doesn't matter what age, what gender, what what sex, what religion, whatever. Anybody can get sepsis. And the reason being is, put in simple terms, sepsis is simply an infection, is the body's extreme response to an infection. So anybody who's ever had an infection, I'm sure everybody here will say they've had an infection before. And when I say an infection, I don't mean like, sexually transmitted infection or something like that. I mean something like even the common cold is an infection. Whenever you had to take antibiotics, anything that makes you unwell is an infection. So, or infection will make you unwell. So yeah, sepsis, the simple definition for sepsis is the body's extreme response to an infection. It can be life-threatening, or it is actually a life-threatening emergency condition which occurs, and it triggers a chain of reactions through the body. So sepsis or extreme infection is something that can basically affect all the organs of the body, because the infection runs in the bloodstream. Whenever you have an infection, it goes in your bloodstream. And the body can respond to it in a very serious way. I know somebody who recently had sepsis, and I said I was going to ask them for permission to use their pictures, but I actually didn't ask them, so I can't use the pictures. But essentially, their eyes were all very swollen. This is a young man, a very young man. He's, I think in his mid-40s. Eyes were really swollen, lips swollen. I mean, he looked like he'd been bitten by a bee, and that's the kind of thing that sepsis can do. And you don't have to be unwell. You don't have to be immunocompromised. You don't have to have any substandard conditions. Once you've had an infection has gone into your body and your body has overreacted to it, basically that is sepsis. It is important to understand sepsis because it can lead to tissue damage and organ failure and death, actually, if not. So most people who come into the hospital with sepsis, if they're not treated accordingly, they will end up dying from it. It is that serious. And this is why there's so much promotion. You would have heard of something, well, I don't know if you've heard, but certainly in the health, from when I was in first year medical school, sepsis 6, like it's literally drummed into my brain. Like, and if I'm asleep and you wake me up and say, recite the sepsis 6, I can recite it for you, because it's that much important to us as healthcare professionals. So I think it's important everybody understands. And I'll come to the sepsis 6 in a minute. It's basically the first 6 things you do if somebody presents with sepsis. You guys don't need to know that, because this is actually, it's a medical thing. That's what we do. But if you're interested, I can talk about it later. Causes of sepsis simply is bacterial infections are the most common ones. Viral infections, not so much, but bacterial infections tend to be the ones. But viral infections can cause sepsis as well. So can fungal infections, parasitic infections. So even malaria, things like malaria can lead to sepsis. The common places, even though it's a multi-organ condition and it can cause organ failure in any sort of organ in the body, the most common ones are your lungs, your urinary tract, the skin, and your tummy, your abdomen. So again, a urinary tract is one that often causes a lot of problems that a lot of people don't think about, because especially, I think I've talked about UTI previously, and I talked about how it's really easy for women to get UTI. And some women get UTI so often that sometimes they don't think about it, and they think, oh, it's just a UTI, I'm not going to bother with it. But if you have a UTI and it's an untreated UTI, and the UTI goes up into the kidneys, then it gets into the bloodstream, this can actually cause really bad sepsis. And just last month, I saw a patient in my hospital a young patient, she was 30, and she was so badly affected by sepsis from a urinary tract infection that she had to be on ITU for about a week. I mean, she was near death. In fact, there was a time that we thought that she wasn't going to make it. She was very poorly. She came in and I was called to see her because I was on call. So the first thing I did, I was called to see her. As soon as I saw her, I said, no, this lady. So I had to get ITU involved, got an anesthetist involved. We had to do everything. And this is a young lady. So it's not, so oftentimes we think it's only older people who can suffer from these things. No, young people can also suffer. And sepsis in particular is very, very bad when it comes to young people. Because old people actually do very well. As soon as they're unwell, because they know they are old and they know so many things can go wrong, they tend to seek medical advice. But young people, we tend to sit on it. We tend to think, oh, I'm healthy. It's probably nothing, but it's very important. So, just be wary of infections. How does sepsis develop? Well, it always starts with infection, and I think I'm drumming on this. And the reason I'm repeating this is because I want everybody to understand that infections are what drives sepsis, and there's no such thing as this is just a small infection. If you have an infection, you need to get it treated, or at least you need to get some medical advice, because if it's not treated or you don't sort medical advice, it can lead to sepsis. So I'm going to keep repeating it, that infection is synonymous to sepsis. Okay, so it starts with an infection in the body. The body's immune response then overreacts to the sepsis. So usually I always say, think about your white blood cells as soldiers of the body. Whenever you get an infection, the white blood cells are deployed and they go off and fight the infection. When you get sepsis, the body releases white blood cells, histamines, cytokines, it releases everything. It releases the full army. And once the full army goes and tries to fight the infection, remember the infection is usually in the blood, and and your blood flows around the whole body. So essentially your body starts fighting your own body. And this is basically the how it develops. The kind of symptoms, or recognizing the symptoms that you get from sepsis, is very high temperature or very low temperature. So our normal body temperature to sit at something like 36.5 to 37.4-ish. Anything above 38, we're usually concerned about. Particularly if you've got really bad sepsis, temperatures can go as high as 39 or even above. I've seen somebody with a temperature of 41 before. And again, this is very, vital. Again, very low temperature. So anything less than 36, we tend to be worried about around 35. So higher or lower temperatures. This can induce sort of chills and shivering. So if you've ever had malaria and you feel like, your temperature is really high, but you're feeling really cold, so that kind of thing. So you're shivering, we call something rigors, you're heavily shivering, sweating, looking out for things like that. Signs of infection could be a sore throat, a wound. So if sometimes somebody cooking in the kitchen, you've cut yourself and you think, oh, nothing of it, and that's fine. You don't have to take a cut to the hospital. Definitely it's okay to keep it. But if that wound starts getting really red, it starts getting really inflamed, it starts weeping, and your hand just starts to really hurt you, and it's throbbing and it's swelling around, and it doesn't look quite right. It doesn't look like it's healing. It's time to get some medical attention, because that wound could possibly lead to sepsis, essentially, and that's just from being cut in the kitchen, So yeah, just look out for signs of infection, like a cough. Yeah, like I said, wound weeping, abdominal pain, UTI symptoms that are not getting better, that sort of thing. One sign that we use to, especially in the hospitals, to figure out if you live with somebody or yourself, is cognitive decline. So like I said, sepsis obviously can affect any organ in the body, and sometimes it can go to the brain as well. Actually, if left untreated, it definitely will get to the brain. A lot of people start to act a bit confused. So again, I don't know if you've heard about something called delirium, and that's usually seen in older patients. When they get an infection, they tend to get delirious, and people can confuse this with dementia. So oftentimes, if you live with an older person and they start acting a bit funny, acting like they've forgotten their car, they're forgetting stuff, you're telling them stuff and they're forgetting, and actually it could be that there's sepsis brewing here. A lot of people say, oh, it's old age, but sometimes if you live with somebody who's not like that and they suddenly become like that, it's worth getting checked out. Again, I'll give an example. 2 weeks ago, I saw a lady in the clinic. Actually, well, I didn't see, my colleague saw this lady in the clinic, and basically her son had brought her in because she was refusing to go. They'd gone on holiday and they'd come back from holiday, and she was refusing to enter her house. And she kept saying, I don't want to enter this house. I don't know this house. And she didn't know. And her son was like, well, this is not usual. So her son just thought, you know what, she's probably dementia is getting worse, I'll leave it. But then 2 days later, she still was saying she doesn't want to enter her own house. So the son was like, okay, I'm just going to go see the doctor, because, it's just odd, and we're just going to test her for dementia. He wasn't even thinking anything of it. He came in and my colleague asked him, oh, is she usually like this, or do you feel like she's not quite her usual self? And the son was like, actually, no, she's very much her usual self. We just feel like it's her dementia getting worse. But after we did a few tests, we found out that actually she had a UTI, which was driving delirium. So infections can cause confusion. Infections can cause changes in people's characters. And if you live with somebody, especially the older generation, and they start to act a bit funny, out of character, sometimes it could be that they've got an infection which is changing their cognition. So in a young person, it wouldn't usually present like that. But in a younger person, it will present with sort of confusion. Suddenly act like they don't know where they are. You're talking to them and they're talking about stars or something, hallucinations and things like that. They definitely think about infection when that starts to happen. And a lot of the time as well, difficulty staying awake. So if people tend to feel like they're falling asleep all the time, they wake up and you wake up and after you've slept for, let's say, 12 hours, and then you wake up and you're going back to sleep. Again, there are other factors that could be driving this, but these are also signs of sort of sepsis. So keep an eye on that. People who are extremely unwell can have symptoms like shortness of breath, chest pain, their heart rate can go really fast. So we call something tachycardia, or sometimes you would have had palpitations, but essentially heart beating very, very fast to the extent sometimes you can actually feel it beating. You can feel your heart beating, and that's called palpitations. So those are kind of signs to look out for in severe sepsis. I think I've talked about I haven't talked about the risk factors for sepsis. I've said everybody can get sepsis. Anybody who can get an infection can get sepsis, but particularly people who have weakened immune systems. So people who have HIV, people who've had cancer or under treatment for cancer, so radio, chemotherapy, people who have chronic diseases. So people who have like chronic kidney disease, heart disease, people who basically we know that are immunocompromised, are at risk of getting sepsis. The elderly people and the very young are at risk of getting sepsis as well. So babies and sort of people over the age of 70, even 65 sometimes, but the older you get, the more at risk you are. Individuals who've had recent surgery. So if you think about surgeries pose a risk for infection, especially if it's a big open surgery, you've got a big wound or scar, it's easy for that scar to get infected, and they're usually at risk of sepsis. And people have thought about chronic diseases like diabetes and and kidney disease. How do you prevent sepsis? Well, very simply, good hygiene practices, especially for those who I was talking about wounds and things. So if you have a wound, you have a cut, just keeping that wound very clean, being hygienic with it, washing hands, cleaning wound properly in an aseptic technique. Getting vaccinations can help. So especially with the elderly people, we always say the flu vaccine and pneumonia vaccines and things like that, because the older you are, if you get some of these conditions, it's easier for it to spread through the body and cause sepsis. So if you've got a vaccine which can help stop that infection or can actually help reduce the effects of that infection on you, that can help stop the sepsis. Early treatment of infection is very important. So promptly seeking advice as soon as you see signs of infection. Again, I'm going to go back to UTI. If you start seeing that there are changes to your urinary tracts, and some people don't even get burning on urination when they've got an infection, they just get increased frequency. So if you find yourself going to the toilet more than often, it's worth getting a check. And I'm not saying it's definitely going to be a UTI, because there are other things that gives you urinary frequency, but it's definitely worth getting checked out to rule out infection. If you start getting a cough, a bit of a dry throat, whatever you feel, I say we have a textbook which tells us when we need to expect when people are sick. I say this to all my patients, and I think I've said it on this platform before, and I'm going to keep saying it. I always say that you know your body better than any doctor knows your body. So if you feel that something is not right with your body, oftentimes something is not right, because our bodies have ways of communicating with us. So if you don't feel well, you just generally feel like something is off, then there is almost like a sixth sense where your body's telling you something is off, get it checked out. Even if it's nothing, it's better to get it checked out than sort of sitting on it and then it ends up becoming something. In terms of people who've had infections and antibiotics, a lot of the time I've heard people say, "Oh, doctor, you gave me that antibiotics for that UTI. I've taken it for 3 days. I was feeling better, so I've stopped taking it." This is one of the things that can also cause sepsis, because when you start taking an antibiotic, is important to finish the course. If we give you a 7-day course of antibiotics, we know why we're giving you a 7-day course, because we know that the bacteria or the organism that we're giving you the antibiotics for can stay up until 7 days after having the antibiotic. So if you start feeling better after 3 days, that's good. It means the antibiotic is working, but it doesn't mean stop. It means finish the course. Because if you stop halfway through taking antibiotics, what you do is you actually, the bacteria that would have initially died from having the bacteria have actually already died. The ones that are remaining are the tougher bacteria, which need a bit more push. And by you taking it for 3 days and not finishing the course, you're actually enabling that bacteria to grow defenses against that antibiotic. So antibiotic resistance can build up from not finishing the course of antibiotics. And also, once you start feeling better, the bacteria are still there. So if you stop taking the course of antibiotics, they can then progress and then become sepsis and become worse infections. So it's definitely important to finish the course of antibiotics. Very imperative. What do you do if you suspect sepsis? Immediately go to A&E. If you suspect sepsis, immediately go to, if you've got an infection and it's not sepsis, like it's not any of the symptoms, I thought it's just an infection, it's okay to go to your GP, or if it's a common cold or like a flu, you know that a GP is not going to do anything about it except for sort of encourage you with fluids and things. If the symptoms start to get worse, go to your GP. But if there are any signs of sepsis, like I said, temperature above 38, shaking, rigors, there's no need to go to your GP, go straight to A&E because that's where you're going to get the top care that you're going to need. Thinking of what else I need to talk about. The treatment for sepsis, again, you will never have to treat sepsis by yourself at home. So there's no need for me to talk about treating sepsis because sepsis is something that we have to treat. If you are so unwell that you have sepsis, there's no way that you're going to stay home. You're going to definitely end up in A&E because you just won't be able to treat yourself at home. But with any infection, it's important to keep very well hydrated. It's very well to keep, like I said, continue antibiotics or whatever management regime that you have for that. But keeping hydrated is very important. I think I'm going to stop there. I can't think of anything else to say when it comes to sepsis, but sort of the key takeaway points from this is that sepsis is a life-threatening condition, but it is treatable if it is recognized early enough. Most of the time, people don't tend to pass away from sepsis because we catch it early and we treat it very effectively. We have an acronym which works, Sepsis 6, it works extremely well. The ones that we don't catch who do die from sepsis are the ones who leave it too late and come in too late. So knowing the signs and acting quickly can save lives. So stay proactive in preventing infections and don't hesitate to seek medical help if sepsis is suspected. Mute.
Thank you, Doc. Thank you, Doc. Right. Thank you very much for your insightful presentation this evening on sepsis. Doc, we'll back down to maybe level kakra. Sepsis, no, I don't need the chim kakra with dream. It means a bad idea, but yeah, maybe no, baby. Sepsis.
Sepsis and tree. Okay.
Saying a tear, ebia, which reach them kakra, will be bit me at say, Brofono meet dear, but at least come down a bit to my level.
I honestly don't even know what words to use to describe it. So, in an infection, how do you say infection in G? Yeah.
Infection, I say infection.
Okay. Hey, Nana, come with you.
All right, don't worry. Young call steps 6 model no with me no so emu kakra.
Yeah. So sepsis 6, the treatment that we use is 6 things. 6 things in total, but 3 things we have to give and 3 things we take. So obibanas or sepsis are, and I'll try to explain sepsis in tree. So sepsis, yeah, infection. I just say infection no affected the whole body. The infection no mojanum and I caught around the whole.
I don't know. Infection no
nti ebetumi akọ wo brain wo knee wo nsam wo baby a and say yen treaty a ebetumi aye owo nti no very important say ebetumi and you can get it ubetumi nya from any infection into malaria common cold, ubetumi from a urine infection. Into any infection, we'll try what the second trial. So we'll know and that's how the second trial one as a when treaty sa cats in the year, ubetumi sepsis a free side, you know. Into any area, Rebecca say, and penny-phone choir and I am buffry area. Obia to me sepsis, obia ubetumi infection, ubetumi sepsis. Into no, I think say me reach the remit of me, you know.
So with this background or with this breakdown, what are some of the symptoms when ubinya sepsis?
It's symptoms now, yeah, most of the time, a person someone for look out for. So when you infection, normal symptoms won't. But now make us so when you infection, you have to make sure say obekọ akohu o doctor na obekọ akohu healthcare professional we na obetumi treat it as infection now. Because one ko hu onwa and then betumi graduate into sepsis no sepsis in signs of when infection so initially when infection say a cold out say urinary tract be as a wardrobe so I be yeah but the abema who say sepsis no yes so temperature kokodru above 38 degrees. I don't know for those who are in US you use Fahrenheit. I cannot do the conversion for you but and as anywhere else but it's 38 degrees Celsius. If it goes above that, say when you say when malaria, yeah, like I say we feel hot, warm, cold, na say we popo, na say we shaky bisa, and hence our symptoms, and also and obey signs of sepsis. Another thing I didn't actually mention, say untumi so dehydration because sepsis takes a lot of water into the ocean. As I was you're very dark. I say you're not managing to pass urine. Sometimes that can also be a sign of sepsis, especially if you have an infection and you're struggling to pass urine. So these are some things that we should look out for. When sepsis gets really, really bad, sometimes to me will say, oh, difficult. So shortness of breath, you're struggling to breathe. And I say when you're like now and I say we are now wakumani biti fast. When we feel it, wakuma no boom, 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 boom. Now, to me, feel it say, yeah, and like name and shed on so yeah, just keep an eye out for these symptoms. Hello, Nana Kwame.
Yo, I was for Dr. Ready, say, over all your questions. Based on the presentation and you may or the what question be or wait me at the about even in the comment section and I say chat room or wait me the question at all. And I saw who zoom no so now mounts as well. And also never found now also wait me at the question about my main fact back about a war chat room on say I will be about causes and prevention. Causes and prevention.
Yeah, so as I was saying before, sepsis is basically caused by infection. You see, any infection that you get, there's a tendency that you can get sepsis from it. It can be, like I said, common cold, malaria, viral infection, fungal infection, even sometimes, something as little as ingrown toenail. And I say, if you've got diabetes and you have a tendency of getting cuts on your leg, even when you're cutting your toenail and you cut a bit of skin and that skin gets infected, that can cause sepsis. So sepsis is caused by any infection. That's literally the definition of sepsis. It's an infection and the body's overreaction to curing that infection. What is the prevention? We talked about sort of hygiene. So if you cut yourself, making sure that you're keeping the cut clean, keeping the wound clean. A lot of the time I say if you've cut yourself in your feet, make sure that you're wearing clean socks. Make sure that you're changing your socks if you do a job which requires you to, have close footwear, especially in the summer months. If you find that you're sweating on your feet, make sure you've got clean socks that you can change into. Cover the wound so that the infection is not getting dust and dirt is not getting into an infection. If you have a urinary tract infection or you find that you're starting to get urinary symptoms, making sure that you go and get that treated. A lot of the time I was saying a lot of people are always There be so feel so wound infection now, corner and treating mouth. If you get a bit of a cold, not a cold, if you have a cough, runny nose, all these signs that show you that you have an infection, and these are not getting better, and the symptoms are actually getting worse. Go and see a healthcare professional about it, because preventing infection or treating infection can prevent sepsis. I hope that answers your question.
Yes, please. Yo, I was here for Sabre. My main dynamic when I'm advert back in Kim. And on each remember na many Dr. Akosua Ofosua for all your questions. Dr. Semi if you have any general health topic and no health question biana why crowd of say obey ano ede amano inti bomodi and for questions in enyina ebra. My main dynamic remember for all your questions.
Tap send. Oh, I was my baby, you're from Calabos. The only boss. With oneness, baby, I will be everywhere I day and everywhere they go. Tap send got me covered. If you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through Tap Send, and guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download Tap Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download Tap Send. Okay? But also, when I receive my money, that's how the world is chilling. Like my view, hey, you crazy.
Download Tap Send now on Google Play and App Store. Tap Send. It's secure, convenient, easy, and fast.
It's all begun in London.
Welcome to the stage, Diana!
So it's only right that the 10th anniversary is crowned with a celebration in London. The Akosua Experience with Diana Hamilton's 10th anniversary edition live in London takes place on Saturday, the 5th of October at the Dominion Centre, 9 The Broadway, High Road, London, N22 6DS. Doors open at 5 p.m. featuring Kobe Mante, Charlotte Appiah, and with special guest artist Ada Ehi.
Congratulations, you're in the glory of God.
God is about to blow your mind. Tickets are £25 standard single, £45 standard double, £50 gold VIP, or £70 platinum VIP with meet and greet. Tickets are available on eventbrite.com or dianahamilton.com. For more information, contact +44 7493 514 477. The Akosua Experience with Diana Hamilton 10th Anniversary Edition live in London. This is the doing of the Lord.
Yo, I was here for me mama Akwaba BMO Edo Eba Aye OT Health Talk and enumerate yene Dr. Akosua Ofosua Aseidu and a train and come na enumerate no about sepsis. Dr. Amayen, the definition, the causes, the symptoms, the prevention. Question be ubetimi ede question no ede aba and answer any general health question biano Dr. Ewa Hanmo say ubeyi ano ede amount and intimi se wa bomodia nafa o question ebra doc mami indika na mimbusa say yes you've been advising on this show I bring you now say who be here say abreni apripia no etimi ekoye yen health check na ebrebe na ogidi say ehun be hia pass itimi ehun yen GP.
When it comes to infections, and I say for just general.
In general.
General, dear. Say okay. I think that's a difficult question because for everybody the answer will be different. So I always say at least have a yearly health checkup. And the reason I say this is because I think a lot of things can happen in a year, and a lot of things can change. It's very important, especially if you have a chronic condition. And you say, oh, what BB to say diabetes and I say high blood pressure, asthma. The funny thing is, even people with these conditions, usually your GP would already make an appointment for you for an annual health check and a medical review. For people who don't have anything sort of lurking in the background, who don't have any issues, you can still do an annual health check where you do your blood pressure, you just go for an annual health check. Or if you like, you can even do it every 2 years, but just making sure that you've got some medical check. So often people can leave it for 5 years, 10 years, and they haven't checked. And then all of a sudden everything will happen at once. But if you have your annual MOT, it's the same as a car. I always say, look at the way that we treat other things. Government, who say it is important that every year you check that your car is performing well, because you're using the car. It's the same way you use your body. Every morning you wake up, you go to work. Every day you go to school, whatever you're doing, you're using your body, and we need to make sure that we're having our annual servicing for the body and annual MOT for the body. So that would be my advice to people. In terms of when to see your GP when you have an infection, like I said, usually if you have a cold or you have a cough or a flu, these are not reasons why, a person should go and see their medical professional. The signs that we usually look out for, that we're usually concerned about, is if you have a temperature. Now, separate from sepsis, which obviously we're worried about temperatures over 38 degrees. But even if you've got a temperature like 37.5, you've got some warmth on your, where you feel warm to touch, a bit of sweating. If you have for the cold, if you have a cough and the cough is green or is a different color, and you've got either brown or red in the cough, these are times where you need to go and see your GP. If you have a UTI, regardless of if you have a UTI, you have to go and see your GP because you need antibiotics. But UTI, the only reason why you don't need to see your GP for a cough or for a cold is because we don't tend to treat a cold or a cough unless it's bacterial infection. We don't treat viral infections. We just advise you to take warm water, rest. But if you have a green sputum with it, or if there's blood in it, then we often think that there could be some bacterial infection here. So then what we usually do is then we give you antibiotics. So these are the two things I think I spoke about. Any heart problem, I would be more obliged to go and see the doctor. So if you've got any shortness of breath, any chest pain, any palpitations, which is feeling that your heart is beating fast, all these things, I will make an appointment to go and see the GP. What else? I think that's there's one thing. I made a video on my TikTok the other day, and I was talking about abdominal pain. Now, this is one that's very important because abdominal pain, one shot won't waste your time in hospital. You have to know when to go to the GP for abdominal pain. So, for example, if you've got abdominal pain, you haven't moved your bowels for the past, let's say, 3 days, and you're basically constipated, you haven't moved your bowels, and you're going to your GP for abdominal pain. I mean, it's not even the GP. If you go to A&E, because a lot of people come to A&E for abdominal pain, it ends up being constipation. You would have been spending more than 4 hours at the A&E just for a doctor like me to come and tell you that all you need is laxatives. You can get laxatives over the counter at your pharmacy. So abdominal pain is something I always advise people on, that you don't always have to go to the hospital with abdominal pain. The signs you need to look out for when you have abdominal pain are things like you've not been able to eat, because anytime you eat, you're vomiting. On top of that, you're having constipation. So if your bowels haven't moved and you're vomiting when you're eating, that is a sign to go to the hospital and skip your GP, go straight to the hospital. Because what are we worried about? We're worried about bowel obstruction. When I say bowel obstruction, basically, there's something that is stopping the stools from coming out. So your bowels are blocked. At the same time, when you eat, because there's blockage and the stools are not able to pass, when you eat or anything that goes and comes out because the food cannot go past the blockage, that's what we're worried about. So this is the sign that at that point, you need to go to the hospital for. Another thing you need to go to the hospital for is if you have pain in your, let me get this right. This is my right and this is my left. So, so on your right side, just under your rib, there's an organ there called the appendix. Now, we're usually worried about appendicitis if you've got right sharp pain here. And again, it's associated with temperature, vomiting, and sometimes, not all the time, but sometimes it's worse on movement. If you have something like that, I would advise you to go again, see your GP, or you can go to the hospital because we're usually worried about the appendix. So these are some of the things. I think I'll do a separate topic, and Nana Kwame wanted me to do that, but I'll do a separate topic on when to see your GP for different, because there's so many things we can cover when it comes to that. But this is sort of the important ones I think I will leave you with today. Nana Kwame, I don't know why you mute yourself because then you never forget to unmute yourself.
Yeah, Semo. There's this question in the chat room. Can every infection lead to sepsis?
Yeah, and I think I mentioned this, every single infection can lead to sepsis. Having said that, I'm not saying that every infection will lead to sepsis. That's not what I'm saying. A lot of infections don't lead to sepsis, but every infection can lead to sepsis. And I even mentioned even something as small as a cut on your finger when you're cooking, or even when you're cutting your nails. If you're cutting your nails and you snip the little corners of your hand, if you don't keep that clean and you don't look after it properly, even a splinter. So you won't believe that getting something as small as a splinter in your hand, because it's an open wound. And if you think about it, an open wound leads, it leads directly to our blood. If infection gets into your bloodstream, it can go anywhere in the body. And depending on how the body reacts to this infection, it can lead to sepsis. So yeah, just any infection can lead to sepsis. So yeah, just be careful.
So I was saying first, so Dr. Akosua Ofosua Aseidu, and you can come on okay, and then you or any, and she will do to answer when things because of Chile Kakra. We are still waiting for all your questions or any general question be with me at Jonas, me ma ajo ene enyumre ma hu se wa join I with me the question about Jonas. Meet yourself now for a question, bro.
I was coming to Amu. I was also mommy. I joke. Yeah, you know, but I think I'm about one part. Me by this year, me the my things are doing. First, I mean, things sepsis. None of them dog or can't about the sepsis and not be bad. Okay, I'm so old. I be a man, because I didn't. Yara no ekunipa no yara no ekunipa no na ya man din de mo ni din ya bi sheki kakra na sepsis je ma me ka say na program no sepsis o si ni sepsis ta na say bi on ka be program no o so anti ni say wa ba o mu adwuma mu anti be friend say o wa ba na si me dey check here mo ba o ba e be check here no e be mon details ba ya ba sepsis ta bibia by no to me body no and the my body but one small idea about sepsis no and the obi friend na man can say sepsis no say by yeah busunya.
Okay. Wait there. What's up? But I think so it would be good to sort of summarize into I tried my tree version and I'm not sure yeah. Echo yes, but I'll say it again and then Nana Kwame can fill in the missing parts of it. So sepsis, it's me a very dangerous infection. So unya infection, and it can be any infection. So it can be common cold, flu, even malaria, and I say urine tract infection. Infection and it can lead to sepsis. And basically sepsis, yes, bacteria and I say whatever is causing the infection, no, it could do more genome. Na say sa moja no ede sa yare no eko other parts of the body. Say to me call wadwene mu ma affect your brain. Now when you confusion, change of character. It me call we ni now na sometimes it me affect your vision. It me call wakoma or chest. Now when you have shortness of breath, akumayari, chest pain. It will go baby. Now usually sepsis, basically the body's response to the infection, and is an exaggerated response to the infection. Into when your infection, usually your body will release white blood cells as some infection, but sepsis just says response to exaggerated, and then that exaggeration goes to all the other parts of the body. So it can lead to death. And actually, sepsis, if not treated, will lead to death. And I always say that, and to say, oh, unya cold, na se when treat cold, or no, our body not to be fighting at the end of there be unya sepsis, na se when treat is as simple as that. And the treatment for sepsis is very, very simple. You have to be sepsis 6. I think that sepsis 6 that you don't need to know this. Usually for the healthcare professionals, because if you get sepsis, you will not be at home to be the one treating yourself. You cannot do it. You have to go into the hospital. And usually it's 3 things, it's 6 because there's 3 things we give to the patient and 3 things we take from the patient. So we give oxygen to the patient. You have to have oxygen. Because if you think about it, your blood and the oxygen, they call organs, no? And because sepsis can lead to organ failure, and that's what usually leads to death. So we have to give you oxygen so that your blood is carrying oxygen to those organs which are failing, because inevitably the oxygen is what would help the organs to sort of revitalize and revoke themselves. We give you fluid, so we'll put a drip on your IV fluid, drip also, because again, we need to do what? Try and clear out whatever the infection is. We need to hydrate you, because dehydration can also lead to more organ failure. And then we give you antibiotics. We give something called broad spectrum antibiotics. And your sepsis antibiotics or if you're allergic to penicillin, usually it's a penicillin-based. If you're allergic to penicillin, we have something that we give. But we give you that medication before we even test, say, problem. No. Those are the 3 things we give you. Then the 3 things we take away from you is we take away your blood samples, because we need to go and test your blood and see that we are treating the right bacteria. So the blood will tell us, okay, and I say bacteria causes our way. So we need to use a more targeted antibiotic. Then we'll take away your urine, because we'll be checking your urine, because I said when you're dehydrated, if you have sepsis, you'll be dehydrated. So something called the urine output, we'll be checking that. And then we take something else called a lactate. And again, like I said, it's all medical, but essentially that's the sepsis 6. And from when I was in medical school, I don't think I can never forget the sepsis 6, because it's that important to us as medical professionals. So I think it's important that, again, everybody knows what's you don't need to know the treatment of sepsis. That's not for you to know, but it's important for you to know what to look out for sepsis and how to get yourself to the hospital as quick as possible if you see any of the signs of sepsis. So I hope, Sir Jonas, ube to me, I summarize it, I'm making what steps is no?
Oh, okay. Thank you very much.
Jonas, yeah, that's it. You don't need to know everything about sepsis 6. So making sure so when you infection about GP, a simple summarized form, and I'm the amount. Doc, we also see GPs always take so long to prescribe antibiotics, and sometimes these infection goes on for far too long before starting treatment. Is that a safe way to go, please?
Mm-hmm. I know, you know what? My GP, I've just started as a new GP practice, and I think they are quite good, honestly speaking. Like, from my own experience and my own GPs that I've had, I think they are very, very good. Like, I know people who call up on the same day and they get same day appointments. However, you're good, I'm singing their praise, I'm telling everybody around me, but and then I'm here later, I'm here, so my main fair reception. I mean, can't say me late. Me di queue no call queue no me di more to say me do ejuma. Like, I was literally on the phone for more than 30 minutes. I was like, wow, saying easy. Because if imagine that I thought to myself, imagine I'm a patient who's not feeling well and I'm trying to call the GP to book an appointment. But that's the waiting list. I had to wait in the queue for 30 minutes just to, and I can honestly understand where the patients are coming from. And because I've been on both ends, I've been a patient before trying to call my GP and not having any luck. But at the same time, I'm also at the GP practice and it's not easy. It really isn't. And the amount of phone calls that our receptionists have to answer in a day and the amount of appointments that we have to receive, I don't see less than 20 patients a day. And that's just me. And let's say we have 5 GP practitioners in my GP surgery. So we're seeing 100 people a day. But even that is not enough. So I'm not making excuses for GPs, and I'm not saying, what you're saying. And I think what you're saying is absolutely right. But sometimes, for me, definitely how I know that my GP works is we triage it. So if somebody has an infection and we think that the person needs antibiotics, they will be top of our list. They will be seen first. If we feel you don't need antibiotics, like if we feel like it's a cold or something, then it wouldn't be. So it depends on what you feel that you might, maybe what you think you need antibiotics for, we don't think you need antibiotics for. And maybe that's the reason why. And I always say this to people, honestly speaking, if you're really struggling to get through to your GP and you feel like you have an infection, which is really getting worse and worse and worse, and you're struggling to get to just call 111. 111 will always pick up. And the funny thing is, if 111 feel like we need to see you, 111 always get in touch with your GP. So if you can't get in touch with your GP and you think, I need to talk to somebody, I'm really feeling bad, call 111. And this is for people in the UK. I understand it doesn't work for everybody. But 111 will triage you, and 111 will say, if they think you need to see your GP, they will call the GP and they will make the appointment. And there's a quicker way to get through to your GP. So that would be the one advice I would give to you. If you think you've got a condition and you need immediate antibiotics for it and you can't get through to your GP, go through 111.
Okay. Ma yemfa Liz for intro and anyway. Liz in Bacho, unmute yourself and ask a question.
Dr. Akosua, thank you very much. My question may be very close to sepsis, but still you mentioned say you take blood. So I was going to ask you, how come sometimes you go for blood tests and after they've taken the blood, they come back to tell you, say, it's clotted, so you need to come for another blood test. What happens there?
Yeah. So if you think about that's actually a good sign to say your blood is working the way you should be working. So, I wish I had a tube to show you. So we have the blood tubes, and inside the blood tubes, we have some sediments, we have some chemicals inside the blood tubes, which actually stops your blood from clotting. Because in a normal person, and even if you think about bleeding, so bleed, yeah, eventually, the bleeding stops, because as soon as you start bleeding, your body releases something called platelets, and these platelets will block off the blood, and they will basically clot and stop your blood from bleeding, your body from bleeding. So that's how your blood reacts. As soon as your blood congregate together, platelets are released, and the platelets basically form a clotting to stop bleeding. In the same way, if you take your blood and you put it into a normal tube, your blood would automatically clot. And that's normal. That's supposed to happen. So what we do is we put anti-clotting in the tube that we take the blood in. So when we draw your blood and it goes into the tube, we have to shake it and then we have to send it off. Sometimes some people forget to shake it, which means that the blood does not mix with the anti-clotting, so then the blood will clot. So simply, if you're there with somebody and they take your blood, tell them, remember to shake the tube so that it doesn't clot.
I'm always telling them to shake it, but most of the time they will call back to say, go back and do it. And it's not easy. I don't like it.
Yeah. And
I'm sorry. It's not you, but then
I understand. Yeah. And I mean, I understand you, because I know who likes taking blood, like it's not fun for us. It's not fun for you. So I definitely understand where you're coming from. Another thing is, it depends on, well, again, I don't know, but it depends on maybe how long they are keeping that blood for, because I mean, the clotting thing in the tube can only last for however long. For example, again, my GP practice, we have blood collection twice a day. So we have one in the afternoon and one in the evening. So we don't leave the blood line around from morning to evening, because we know that it has more of a chance to clot. So usually we'll make sure we collect it. Some practices, they leave the blood line around for the whole day, and then they have one collection at the end of the day. This can also sometimes make the blood clot. In the hospital, I've taken blood of people and sometimes the blood has clotted. So it really depends on some of the environmental factors, how the blood is being stored, how the blood is being traveled. There's a lot of things, but if your blood is clotting, then that's actually a good sign to say your blood is actually working in the way that it should be working.
Can it also mean that you've got too much platelet? That's why it's clotting, even though you go anti.
Yeah, it could. And again, I guess I didn't want to touch on that because I think that's a whole conversation on it in its own. But if you were having too much platelets as well, that would come back in the blood test. So if your blood keeps clotting when they're sending it over, when your blood results come back, it should show that you've got extra platelets. It would be picked up on. So if that's never been picked up on a blood test, then that means there's nothing wrong with your platelets, and that is just the environmental factors, the storage and the transport of the blood, and we're getting something wrong between those sections.
Thank you very much, Doc.
My advice would be that I know, again, I don't know how it works in, the part of the world in which you are. I don't like wherever in the UK you are, but like in my GP, we offer patients two options. We always say you can take the blood at our GP practice, or we can give you a blood form and you can go take it at the hospital. So if you feel that when they take it at your GP, the blood is being clotted and that you're always having to repeat it, why don't you next time try the option of not taking it at the GP and actually taking it at the hospital, test the difference and see? Because I suspect that the hospital, your blood will probably not clot because you're at the hospital and they have the labs there and they will run the tests quicker than having to transport it from the GP. So next time, try taking it from somewhere else.
My dear doctor, my GP practice can't take my blood to save their lives, so I always go to the hospital. So it's the hospital where it's happening.
The hospital,
now I'm giving more information now, so let me keep quiet.
Okay, bottom line, try a different center. Okay, try taking it at a different center. Try somewhere else and see how you get on with that.
Thank you.
No problem.
Right. I think at this point, one you should be beer and necra on this show. What's you say oko now koye blood test. Kai almost say almost shaky bottle, almost shaky no. All right. So at this point,
shaky baby and so no should cry back clotting too quick. And yes, shaky. They said
we do a movement. It's called, so we rub it. You have to rub it. So you rub it together to allow it to mix, or you turn it up and down like that, and that's how we usually mix it.
I hear an end of shaking the brain, so an infection be as a cobem. Okay, that's just by the way. Yo, I had a river
So I mean, I think I've said pretty much everything I would say, but the key points I'm going to stress on again is that sepsis is life-threatening. Like literally, you can die from it, and actually, you will die from it if you don't get it treated. So it's important to notice the signs and know how you can quickly get help when you need. So knowing the signs and acting quickly can save lives. And we need to stay proactive when you get an infection or you feel unwell. Stay proactive in knowing your body, knowing when to seek medical advice. And there's nothing as a silly question when going to your doctor or, oh, sorry, doctor, for wasting your time. There's nothing like that. Even if you go into the hospital or the GP and it ends up being nothing, it's better to be sorry than to be, the late. So definitely always be proactive and making sure to take care of yourselves. And keep clean, stay hygienic, stay safe.
Okay, that's it. Saying the length of time you still A&E, no, never wado. You better want some actually. Why?
A&E, yeah, honestly, but A&E, I wouldn't advise anyone to go to A&E unless literally you're dying. Into their honestly, because it's too much. Like maybe it was asking is open a can of worms because Mr. I mean jai. Do you know what I mean? Yeah. But we will come back, and like I said, we'll come back and talk about ways in which you can avoid it. There are other services you can use, walk-in centers or 111 or A&E. So those 12 hours A&E is too much. Honestly, it's too much. So yeah.
Doc, that's it. And then you may any time when you're MI, which may be so. You may add next week. You better sign Hey, next week na uni han by any Dr. Mustafa Beshia next week. You. Any nyame eyaduma mo holidays in the bar yebeshia. Abusiafo ahanomo ene ebrema ko edi show no ebesi. Kai se nyame eyaduma ochina time with Tap Send, and we'll be talking about cybersecurity. Cybersecurity idea be a mijidi say yenyina hu be here see is that scammers for Ahanomo and Akwami. And I want to say a very big thank you to my producer, Ura Ben Ahin. I always forget about my producer, Ura Ben Ahin. A very, very big thank you for all that you are doing behind the scenes. A very good night to all of you. Good night and bye-bye.
Good night. Bye.
Whitewall Properties has all your property needs at amazing prices. Our unique development includes our flagship project, Arlington Court, which has a panoramic view covering several acres of Accra's skyline. Some of our standard features include our gorgeous swimming pool, fitness centre and a communal garden.
Tap said. Oh, Akosua my baby, you're from Calabos. The only boss. With oneness. Baby, I will be everywhere I day and everywhere they go. Tap Send got me covered. Akosua, if you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through Tap Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download Tap Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download Tap Send. Okay? Boss, when I receive my money, the other time I would have challenged, like my view, you know, hey, you crazy.
Download Tap Send now on Google Play and App Store. Tap Send. It's secure, convenient, easy, and fast.